Hello everyone and welcome back to my channel Physiotrendz. This is me Physiotrendz and we are discussing the series Physio Quest question number 38. My dear friends, this week's second question I asked about the accessory motion of the patella, and the question goes something like this: that a physiotherapist examines a patient 2 week status post right total knee arthroplasty. During the examination, the therapist notes a significant restriction of passive and active inferior patellar mobility. So, which of the following would be the most likely clinical findings? And option given are: option A, diminished active and passive knee flexion; option B, presence of an extension leg; option C, increased pain with active range of motion; option D, diminished knee flexion strength. Now my dear friends, here we just have to understand one basic thing, that if according to the question's information, if the restriction is present in the patellar mobility in the inferior direction, which movement really comes along with this inferior movement of the patella? Now we know that clearly that this, when you're performing flexion of the knee joint, your patella is going to glide inferiorly. Yes or no? Yes, right? So because of that, if there is a restriction actively and passively for performing the patellar mobilization in the inferior direction, it is going to restrict the movement in the knee flexion, and that typically goes along with the option A, which states that there will be active and passive limitations in the knee flexion. Now why it cannot be extension leg? Because extension leg requires patella to go in the superior direction, and the question clearly it is mentioned that there is restriction only in the inferior direction movement of the patella. So that is why my dear friends, here the answer is very easy to give, which is option A, that there will be restriction in the knee flexion actively as well as passively. So I hope you have got the answer correct. I think most of you have got it correct and I'm really proud of it. See you back again next week with more questions and more explanations about the conditions. Till then, keep sharing Physiotrendz Physio Quest series and also subscribe to my channel Physiotrendz for more and more videos like this.